All right. Hello, everyone. My name is Naim Duran. I am a fourth-year medical student at the University of Arizona College of Medicine, Phoenix. My topic today is social media contagious? TikTok tics or functional tic-like movement disorder. So as we all know, the COVID-19 has had a global impact and has in many ways changed overall well-being and mental health. We have seen an increase in anxiety and depression. For this topic, I'd like to go over the increase in the incidence of these sudden onset functional tic-like behaviors in adolescent young women. So recently, young women have gravitated towards social media, especially with COVID-19 and being confined to the home and quarantine. They have not only been exposed to many users using the hashtag Tourette syndrome, but also been posting to TikTok with the hashtag Tourette syndrome to show their symptoms and raise awareness. So this phenomenon has been labeled TikTok tics, and more medically, perhaps as has been published, functional tic-like movement disorders. And clinicians have been calling this possibly mass hysteria, mass psychogenic illness, or a social media contagion. This review will describe the new phenomenon, its impact, and review of the literature. So what are these TikTok tics or functional tic-like movement disorders? Right in the end of this paragraph, you'll see a QR code that, if you're interested, will lead you to a YouTube video of a compilation of users using the hashtag Tourette syndrome on TikToks. Very interestingly, a lot of these patients will present with motor and vocal tics. The motor tics have been seen as more abrupt onset, and they have had large amplitude arm movements, very commonly self-injurious movements, as you will see in some of these videos, and often sometimes can be directed towards others. The vocal tics have been really odd words and phrases. Really interestingly, in the beginning of this video, you'll see a young adolescent female saying woohoo plenty of times. Other words have been beans and flying sharks, as one of the studies showed. These are being overly represented in the utterings. So if you're wondering, like I was, why flying sharks, popular TikTok user is a German male who uses the hashtag Tourette syndrome and repeatedly uses the word flying sharks as one of his vocal tics, and has been developed by a lot of these young adolescent females. There has been a focus of internet viewing of others with similar presentations and those with Tourette syndrome, and an increase of views with the hashtag Tourette syndrome, which brings a question of whether or not this is Tourette syndrome. We know the epidemiology of Tourette syndrome to be predominantly male at a ratio of 4:1, and starting at the ages of 5 to 6 years. So this presentation being in young adolescent females ranging from 8 to 24 years is a very different epidemiology, and that's a significant difference. Another difference between functional tic-like movement disorder and Tourette's is these motor tics in Tourette's can commonly be eye blinking, head movements, sniffing, and clearing of the throat, and vocal tics being simple words, sounds. Most importantly, I think a differentiating factor, and one that physicians noticed and began to take more interest, is that they noticed repetitive tics among these adolescent young females, whereas in Tourette syndrome, more commonly, the tics can be unique to each individual. So I think this is an important differentiating factor in recognizing the difference between Tourette syndrome and TikTok tics. The prevalence of these functional tic-like movement disorders versus Tourette's, one study in the UK found a hospital that saw 4 to 6 referrals of females per year prior to the COVID-19 pandemic, and 3 to 4 referrals per week during the pandemic. The prevalence of these functional tics is 2 to 10%, and the prevalence of Tourette syndrome can be anywhere from 0.19%. So the TikTok use, we've seen a dramatic increase. As of March 2022, there were 1.2 billion worldwide active users, 13.8 million being in the US. 57% of those female users, and 42 of them were ages 18 to 24 years old. So really seeing an increase in these tics, and seeing the major use of TikTok use in the same population really increases the idea of whether or not TikTok has a part to play in these tics. The impact of these functional tic-like movement disorders, if you were able to see the video from that QR code on YouTube, you can see that some of these patients have significant incapacitations, and which can bring a lot of frustration and mental health issues among these patients. And so patients that seek medical care may have been disregarded by medical providers who did not have much knowledge about the condition, being that it is so new, and being that it is in a new epidemiology as compared to Tourette syndrome. So this disregard may have led to the patient going more into social media and searching for answers, searching for a community using the hashtag Tourette syndrome, because many of these patients believe that they have a variant of Tourette syndrome. And as a result of this, those with Tourette syndrome have responded in almost a defensive manner as a manner to protect their illness as a serious known medical condition. And so this obsessive searching and posting leads to a repetitive and reinforcing issue with TikTok, where they've seen that sometimes these tics may even worsen as a result of getting likes on social media, getting more exposure, getting more followers. These tics may be worsening as a result of that. The literature review found 24 English language articles utilizing those keywords that you see here in the poster. One study of 185 patients who presented with these tics during the pandemics. 100 were female with an average age of 13.8 years. And anxiety and depression were diagnosed in 95 of these patients. About 18% of them admitted to viewing social media. And in another report, there was a 60.1% increase in the diagnosis of functional movement disorders since the onset of COVID-19. And 75% of those patients were female. So really begs the question and the topic of mass sociogenic illness and the part that social media has to play in this tic disorder. So mass sociogenic illness has been defined as rapid spread of symptoms in members of a cohesive group where there is no known infectious agent or organic etiology that originates from the nervous system involving excitation, loss, or alteration of functioning. Mass sociogenic illness has been recorded as early as the 13th century and really has had more and more prevalence ever since then. Most recently in Portugal in 2006, there was an outbreak of a rash in teenagers where they also developed dizziness, shortness of breath, and after a lengthy search of toxins, bacteria, viruses, and fungi, they correlated this outbreak with an episode of a popular soap opera called Strawberries with Sugar, in which a character in this show developed a mysterious rash that was very similar to the same symptoms that these teenagers were actually developing in real life. And so just this poster presentation is an educational review just to talk about how TikTok and social media has been related to this mass sociogenic illness of functional tic-like movement disorders, and whether or not this could be the beginning of seeing how social media has more of a role to play in mental health issues, and being reinforced by the COVID-19 pandemic, where young adolescent females and a lot of the patients being exposed to social media spend lots of time online, spend much of the time indoors, and being exposed to many of these symptoms and eventually developing themselves these symptoms. So it'd be really interesting to see going forward of whether or not social media will continue to play a role in these functional tic-like movement disorders, and really interesting to determine whether or not these patients will develop long-term sequelae of these functional tic-like movement disorders. I'd like to thank the Arizona Psychiatry Society for allowing me to present on this topic. And I'd also like to thank Dr. Levitt for helping me with this project.